Hi, I'm Philip Jameau, rhinoplasty surgeon. My rhinoplasty philosophy centres around reshaping noses such that we achieve the best natural looking aesthetic possible that's in balance with a patient's face, maintaining or improving nasal function in everyone, and using techniques that definitely do not compromise and in many cases improve nasal structure and integrity to achieve a long-lasting result. I perform open rhinoplasty as it achieves the best possible exposure of the nasal structure and allows the most control of the aesthetic. I know many amazing closed rhinoplasty surgeons around the world, but even these would concede there are techniques and degrees of structure control that can only be done via the open approach. I do a lot of complex revision work, and a mainstay of this is the open approach. As you can see, the resultant scar is really very inconspicuous. Control of the skin soft tissue envelope is the cornerstone of a good rhinoplasty. We can nearly always build a good framework, but the thickness, reactivity and scarring of your skin envelope will strongly dictate what your ultimate result will look like, how long you will take to achieve your final look, and how intensive the post-op process needs to be. In this regard, all surgeons differ in their approach and experience, and this is the large part of the art in rhinoplasty, especially in harder cases and where we're trying to achieve excellent aesthetic results. I use a piezotomy in all cases and have for over 8 years. This is a very fine powered device that allows me to shape the bony components of the nose with a degree of finesse and safety beyond what I feel can be achieved with traditional rasps and small chisels. The use of this is less common in Australia, but ever increasing, however widely recognised internationally. I do perform preservation techniques for those of you that have researched various styles, but for a surgeon who does a lot of complex noses and revisions, preservation is less commonly applicable. Like most preservation surgeons, I do only perform it on the nasal bridge. As for the tip, I prefer the control of traditional structural techniques over preservation. Rhinoplasty can be one of the most challenging operations possible. I'm very experienced and rely heavily on structural techniques, reinforcing and rebuilding a robust framework. This definitely doesn't mean a larger nose, but it does mean a stronger nose. Yes, the healing can take longer and the aftercare may be more time intensive, but the degree of control it offers, how good I can make your nose look, the positive impact on your nasal airway and the longevity of the result, for me, are what's most important.